This is Dr. Vinay Samuel Gaikwad, Director of Surgical Oncology at Birla Hospital in Gurgaon. In this video, we're going to be talking about a Whipple pancreatoduodenectomy or Whipple procedure. This procedure is done for tumors or cancers of the pancreas which are towards the right side, which means the head, neck or uncinate process of the pancreas. So the first thing we have to understand is what is the pancreas and where is it located in our abdomen. So if you look at the model here, you can see that the liver and stomach are covering the pancreas here, and behind the pancreas you can see this white structure in this model, which is the pancreas. It's way back in what we call the retroperitoneum, and that is where the exocrine and endocrine functions of the body are maintained. What exocrine functions are the secretion of digestive juices to help the food digest, and the endocrine function is mainly the maintenance of the sugar levels because it produces insulin. Also, if you look at this chart here, you will see that the pancreas is neatly tucked away behind the intestine and the stomach, and it is very closely related to the bile duct and the liver in this diagram. Now, when we talk about the procedure called the Whipple procedure, what we are essentially doing is removing that part of the pancreas which is affected, as well as the surrounding areas. So if you look at the diagram here, you can see that this would be what is the manifestation of the tumor, and you can see that the entire pale segment here, the white segment, is what is removed during a Whipple pancreatoduodenectomy. That means about 20 to 25% of the pancreas, along with the bile duct, along with the duodenum, and sometimes part of the stomach, not necessarily always, and all the lymph nodes surrounding this. So after the procedure, this is what the anatomy of the patient would look like. It would look like the bile duct anastomosis, the pancreatic anastomosis, and the anastomosis with the stomach. So there are three points which are joined back together: the pancreatoduodenostomy, the hepatoduodenostomy, and the duodenogenostomy or gastrojejunostomy. So with these set of information that I've just given you, I hope one can better understand what this procedure entails. It's a very safe procedure when done at good high volume centers, expert centers, and there's less than 1% chance that it could be a fatal operation, but the benefits far outweigh the risks of this operation, and it's very, very important to understand this operation well and not be afraid, but to take it on as a very important part of the treatment for pancreatic cancer and other pancreatic tumors. I hope this information has been helpful.